Hello, everyone, and welcome. We'll get started in just a moment as we allow for the attendees to enter. All right, we'll go ahead and get started. Thank you so much for joining us today. And thank you for joining the Centers for Medicare and Medicaid Services at the Office of Minority Health in our Minority Research Grant Program Application Assistance webinar. My name is Ashley Petticord-Austin, and we're really pleased that you could spend some time with us today. Before we dive into today's webinar, I would like to share the purpose. So the Minority Research Grant Program, or MRGP, as we often call it, has these sessions in order to provide some additional assistance to possible grantees by providing background information, firsthand experience from those who have been through this, and answer any questions that you may have. We hope that today's session will be able to help you get more familiar with our program, especially as you consider whether your institution would like to apply. So joining us today is Dr. Flora Ukoli of Meharry Medical College, and she was one of our 2007 grantees. She'll speak about her institution's research and share some experience applying for the grant. We would like today's session to be an opportunity for you to learn about the Minority Research Grant Program broadly, but also from the perspective of a grantee who was previously in your shoes. We can go ahead to the next slide. So here's our agenda for today. We'll begin with an overview of the program, MRGP, as you'll hear us call it, followed by a presentation from Dr. Ukoli, details on this year's 2023 Notice of Funding Opportunity, which would include eligibility requirements and how to submit an application via the grants.gov website. And then after those items, we'll conclude with time for questions from the audience. On this slide, we also have instructions regarding accessibility for today's event. To access the live transcript feature, go to the menu at the bottom of the screen and click on the live transcript icon. After you click the icon, click on View Full Transcript, which will allow closed captioning to appear at the bottom of your screen, and then the transcript will show on the right-hand side of your screen. Next slide, please. So before we dive into the overview of the program, we wanted to give a little bit of background on CMS and our office. So CMS, Centers for Medicare and Medicaid Services, is the largest provider of health insurance in the United States, responsible for insuring more than 160 million individuals and making sure that they can get the care and coverage they need and deserve. Our office, the Office of Minority Health, or OMH, as you'll see it written, is one of 8 minority health offices within the larger U.S. Department of Health and Human Services. We serve as the principal advisor to the entire CMS agency on the needs of minority and underserved populations. That includes racial and ethnic communities, people with English proficiency, limited English proficiency, lesbian, gay, bisexual, transgender, and queer persons, persons with disabilities, and those who live in rural areas or otherwise geographically isolated areas, and persons who are otherwise affected by poverty or inequity. We can go to the next slide. We'll start with a brief overview of the Minority Research Grant Program. Go ahead, please. So again, as we often refer to it, MRGP, it's administered by our office to support researchers at minority-serving institutions that explore how CMS can better meet the healthcare needs of the populations we serve. Additionally, MRGP supports CMS's efforts to advance health equity by increasing understanding and awareness of health disparities, developing and disseminating solutions, and implementing sustainable actions. Next slide, please. For the last 2 decades, CMS has provided MRGP grantees with funds to further health equity research to support researchers pursuing topics that impact minority populations, investigate the root cause of health disparities, and foster the dissemination of the grantee research within our programs. The grant program gives our communities the opportunity to benefit from the research, as well as the fantastic opportunity to help minority-serving institutions and their researchers to grow their work and their portfolio. We'll go ahead to the next slide. We do have a short video that highlights the Minority Research Grant Program. So we will now show this video.
The Minority Research Grant Program helps researchers at minority-serving institutions like yours build a portfolio while funding studies important to the healthcare needs of medically underserved populations across the nation. As a grantee, you can investigate the root causes of health disparities, share best practices for reducing these disparities, and better improve the health of racial and ethnic minorities, people living in rural areas, individuals with disabilities, and sexual and gender minorities. Becoming a grantee allows you to partner with the Centers for Medicare and Medicaid Services, grow your research credentials, increase the public's knowledge on health equity, and share your findings to join the ranks of other Minority Research Grant Program awardees who have published dozens of manuscripts that have been widely cited. For over 2 decades, Minority Research Grant Program awardees have uncovered health equity barriers and solutions in the U.S. by addressing a variety of issues in chronic conditions and healthcare access. The Minority Research Grant Program strengthens the capacity of historically Black colleges and universities, Hispanic-serving institutions, tribal colleges and universities, and Asian American and Native American Pacific Islander-serving institutions, and helps widen the pipeline of researchers making a difference in disparities affecting minority healthcare. To learn more about the Minority Research Grant Program, eligibility requirements, and how to apply, visit go.cms.gov/minorityresearch.
Thank you so much, team, for helping us play the video. And for those who maybe couldn't see or access the online content right now, it's a graphic video. It's only a couple of minutes long. So if you're interested in sharing it with your colleagues or others to help spread information about the program, please feel free to. It is available on the CMS YouTube. So we'll go ahead to the next slide if we could. And at this point, I will be turning it over to our next speaker, Brian Young, who is the lead for the grant program within our office, and he'll review a little bit more detail about the program.
Hello, everyone. My name is Brian Young, and I am a public health advisor within CMS's Office of Minority Health. Through the Minority Research Grant Program, we've set out to achieve several goals. The first is to develop capacity at minority-serving institutions to research health disparities and social determinants of health. This support for minorities researchers helps them grow to a point where they can conduct research independently and be competitive for other major grants from other funding institutions. Next slide, please. The second goal aims to understand the root cause of issues that lead to health disparities and identify repeated interventions. Institutions investigate these root causes by exploring local conditions and populations, specifically medically underserved populations. Next slide, please. Lastly, the research funded by the MRGP uses various methods to broadly disseminate best practices for addressing health disparities, providing culturally competent care for all patients. CMS reviews these findings and best practices to strengthen CMS programs. Next slide, please. So I'd like to share a few summary highlights from the 48 grantees funded between 2005 and 2020 MRGP cycles, so you can better understand the impact MRGP has had on the grantees and the grantees' research has had in the communities. The MRGP has funded a range of projects focusing on various populations that experience health disparities. Grantees from historically Black colleges and universities and Hispanic-serving institutions have focused on health disparities affecting African Americans and Hispanics, respectively. Through research efforts from the funded grantees, we were able to see the impact MRGP has had. Many of the grantees reported disseminating their findings academically through peer-reviewed journals and conferences, as well as to the communities that they served or that participated in their research. The Minority Research Grant Program is an opportunity for health equity researchers to not only expand their research efforts, but to also disseminate their findings through diverse methods. Next slide, please. So we have funded health equity researchers at minority-serving institutions through the MRGP for almost 3 decades. This slide shows our 2022 grantees, the Board of Trustees at the University of Illinois, Prairie View A&M University, and the University of Hawaii, who have all examined critical public health disparities. Next slide, please. So now I'd like to introduce our next speaker, our featured grantee, Dr. Flora Ukoli, on behalf of Meharry Medical College. Dr. Ukoli, you may begin.
Next slide, please. So this study took place at Meharry Medical College, and we were partnering with our health center, Matthew Walker Comprehensive Health Center. These two institutions are known for one thing. They have one thing in common. They provide health services for underinsured and uninsured persons. And most of the people we see here are African Americans. Next slide. So my study then in 2007 was about prostate cancer screening. The reason I picked this topic is because prostate cancer is the most commonly diagnosed cancer among men and the second leading cause of cancer deaths among men. And African Americans are disproportionately burdened by this disease, and their incidence is like 23% higher than the incidence in white men. And they unfortunately had a twofold higher mortality than whites. And it is believed that this is because they present late, because they didn't have access to preventive health care. But some people also think that there's a biological basis to do with their genetic predisposition to the disease, or that there's a different prostate cancer variant that affects Black people. Next slide. So this lower screening rate that we're talking about is highest among older African Americans and men of low income. And it is also because they don't have enough knowledge about the fact that prostate cancer can be detected early and therefore get a better treatment outcome. But you see, the issue they have is they have limited access and they have competing priorities. There are other things in their lives that prevent them from going for preventive health care. So strategies that are out there to make this a better situation is to improve the knowledge and the attitude about prostate cancer, particularly among men at high risk. And so that means we want to look at men who are African American, men who are low income, and those who have a positive family history for prostate cancer. Next slide. The goal of my study was to improve prostate cancer screening rate among low-income African Americans. Most of the time we say non-compliant because these are people who did not show up for screening at the right time. The aim of the study was to improve their knowledge and their attitude towards early detection of prostate cancer. The specific objectives of the study were as follows. Evaluate their level of knowledge and attitude about prostate cancer, identify screening barriers, and then we want to develop a culturally sensitive educational intervention for these men. And we're going to use the focus group, and we're also going to use what we call the community advisory board. This board will be a group of 10 to 12 people who will be representative of the African American community. Then the fourth objective was to evaluate the efficacy and the impact of this intervention. Next slide. This is just a quick diagram to explain that we decided to arrange our activities into 4 phases. In phase 1, we assess the problem and we use 3 different 10-person focus groups. And then we summarize all what was discussed. Then the phase 2 is to develop the intervention in partnership with the said community advisory board. Then phase 3 is to implement the intervention, and we were going to use community navigators who, in the view of the advisory board, should be African American men. And then in phase 4, we do the statistical evaluation. Next slide. So here is how we selected the people in the focus groups. You can see that we had men who have been screened and diagnosed with prostate cancer. We had their family members, and we also had men who had never been screened. So we had 3 different types of focus groups. That's because we're looking for all kinds of views. And then the community advisory board, you can see we had 7 lay African Americans, 5 men, 2 women. We had 2 community leaders, and then we had 1 physician. Next slide. So in the first year, we recruited 366 people. They completed the survey and they received the information and the education. But when it came to follow up, we were only able to find 148 to complete the follow-up survey. So the research staff, again, we had more than 4 actually, but let me just say 4 community navigators that were trained, but only 2 were active. Then we also had a research coordinator, 2 were trained, 1 was active. And then we had a bunch of students, medical students who assisted at one point or the other. Altogether, there were 5 students who were in this project. Next slide. These are just quick results. I can't go through all of this, but I'll just say that most of them, over 80%, were aware that there's a blood test for prostate cancer and that the cause of the cancer is unknown, that they're supposed to use surgery to remove the cancer. You know, a lot of people knew all of that, but to our shock, there were some things that some people said that were not right at all. If you look at the tail end of this graph, you will see that some people said screening starts at the age of 25, and very few knew that you needed a biopsy to confirm the diagnosis. And some people were saying that vasectomy was a risk for prostate cancer. So most people knew a lot, but there were some people who didn't know about prostate cancer. Next slide. Here you can see that this graph just shows you the level of knowledge by income. So those who had excellent knowledge, that is the green bar. Those who had good knowledge is the red bar, and those who had poor knowledge is the blue bar. So you can see that poor knowledge was highest among the lowest income group. So that's about 20% of them had poor knowledge. While among the people who earned 50,000 and above, that percentage was about 3%. Next slide. So the barriers to prostate cancer screening that we identified, the first one was cost. 44.8% of these men did not have health insurance, and they stated clearly that they didn't have out-of-pocket money to pay for this. Cancer phobia, about 33%, 1/3 of them were afraid of the diagnosis, and some were just afraid of the examination, particularly the rectal exam, and they thought it was going to be painful or uncomfortable. Now, scheduling conflict was about 1/4 of them said they couldn't schedule their time. And then about 1/3 of them also said they lacked information about screening and they did not know where to go for the screening. Next slide. In summary, we had 252 men aged 40 to 81 with a mean age of about 51 years, and about 60% of them had high school diploma or less. So many of them rated themselves to be in good and very good health. About half of them said so. But health insurance coverage was very low. It was quite low. And their knowledge, as we said, was not very good in some groups, especially the older men, 65 and older, were more knowledgeable. But the younger men who really need to know and go and get screening early appear to be less knowledgeable. And the major barrier to screening was lack of health insurance or cost. And fear of cancer diagnosis was just the second barrier to screening. Next slide. The lessons we learned at this time was that using the focus group and the community advisory board was very effective. So that's a good thing people should use in future, continue to use them. Community navigators are central to the success of this program, but they really and truly need additional training, or we need to be hiring or recruiting people who already have some form of training with community outreach and data collection. I used a fee-for-service strategy because I wanted to encourage the community navigators to do their job, but you have to be careful with that because there are some drawbacks to fee-for-service strategy. As for the policy implication, primary care providers should continue to offer prostate cancer screening routinely for men who are not insured or underinsured. Because when you decide to say that you want to share decision-making, you're sort of throwing the ball back into the court of somebody who might not be very knowledgeable about the screening process. Next slide. So let's look at the grant submission process. In my case, the instruction was concise and easy to follow. All the dates for deadline, because they tell you when you can submit and you should submit before deadlines, they were all there. And they had the names of the contact persons that you reach out to if you're having any problems. But what made it most easy for me was that I had other people at Meharry, one other person who had done this grant before, and that person was my mentor, and we worked together. Actually, her name was also on the grant. And so when you have a mentor and you're working with a mentor, everything appears to be a lot easier. Next slide. The funding. So money is a very delicate thing to handle, but in my case, we just made sure that about 50% of the money went to salaries of those who are on the grant. We used about 5% of the funds for equipment and travel, and 8% went to our health center. They had a sub-award because most of the men we saw, we gave them their address to go and get their prostate cancer screening there. But now, this was a 2-year grant. So some of the money in the second year, we had about 12% that was used for paying the community navigators. They did about 630 hours, 2 of them in a year. And then we had a lot of money put aside for the community participants because we were interested in giving them cash, because one thing that stops them from participating in studies is transportation. So we had, and that was the money for all of that. Next slide. And that is the end. Thank you.
Thank you, Dr. Ukoli. So next we're going to review MRGP's Notice of Funding Opportunity. So next slide, please. So I'm excited to share that on May 11th, 2023, CMS OMH released the 2023 Minority Research Grant Program Notice of Funding Opportunity. We are now accepting applications via grants.gov, and the deadline to submit applications is Wednesday, July 12th, 2023 at 3 p.m. Eastern Standard Time. This year, we can award grants up to $333,000 each to eligible institutions. Next slide, please. Now, before we provide a demonstration on how to properly submit an application through grants.gov, I would like to go over some of the eligibility requirements. Next slide, please. Applications undergo a thorough review process, evaluating the level of innovation, community collaboration, and scientific rigor. To be eligible, researchers should focus on developing suitable interventions for health disparities impacting minority populations. Health equity researchers with suitable projects from the following types of minority-serving institutions may apply: historically Black colleges and universities, Hispanic-serving institutions, Asian American and Native American Pacific Islander serving institutions, and tribal colleges and universities. Newly eligible minority serving institutions in 2023 include predominantly Black institutions, Native American serving non-tribal institutions, and Alaska Native and Native Hawaiian serving institutions. For more information on eligibility requirements, you can visit the program's website listed on the screen. Next slide, please. Next, we will provide a demonstration on how to properly submit an application through grants.gov. Next slide, please. When you visit grants.gov, the first thing you will need to do is click on Search Grants tab. Next, you will type the MRGP grant number into the opportunity number box and click Search. Make sure you include the dashes as they are part of the grant number. Next slide, please. So once you've clicked Search, the MRGP grant number will appear, and you will proceed by clicking on the actual grant number. Finally, the minority serving grant opportunity will appear, providing more information such as the grant synopsis and eligibility requirements. Once you have completed reading all the MRGP requirements, you may proceed by clicking Apply. Next slide, please. So now we will have our Q&A session. So you can submit your questions using the Q&A feature, and we will answer as many questions as time allows. Are there any questions in the chat for the Q&A?
Thank you. Yep. So if you go to the bottom where you often find like mute and video and all that, there is a Q&A. You can type it in there. I believe you're also able to use the chat if that's easier for you as well. So Brian, there was one question while people start thinking and typing in that I thought we would bring up, which is about actually using the grants.gov platform in the deadline. So as we understand, it's advised you don't wait until the last day because it is not as quick as filling out a form and making an attachment, right?
Yes, and then sometimes grants.gov may have like downtime, so it's best to at least submit it a couple of days before the deadline.
And then the person who is actually authorized from the minority serving institution needs to be the one to actually submit the application, correct?
Correct.
Okay. So even if you aren't a minority serving institution, but you're partnering with them, you would work with them ahead of time, but the actual submission has to be done by the person with authority.
That is correct.
Okay. Now, we do have one question in the chat, and please feel free. We have tons of time, so as many questions as you have, we'll get through what we can. We do have one question that is asking about the letter of intent. Brian, do you want to speak to that a little bit?
Yeah, so the letter of intent is optional, and you didn't have to submit one. You can still apply for the grant.
Yeah, and I think that deadline passed, right? So
yes, I think it was the 11th.
Yeah, I think it was just the other week. So if you haven't done it, no worries. But if you have, that's good information. So we do have one question in the chat. Can more than one researcher apply from each institution if their focus area or the thing that they're submitting for is something different? So that would be like one school would have two different applications, basically, like two different topics. Can you speak to that, Brian?
Yes, so that is totally normal. You can definitely submit more than one application from your institution as long as it's different research.
All right, great, thank you. And Dr. Ukoli is on still. If you have questions directly for her, we'll defer, of course. So I'll let you know if there's any that look like they're meant for you. All right, going back to our Q&A here. So the research project can be done by our university. We are a Hispanic serving institution. On the local community or the city, by students, by faculty, or both.
So are you saying who should submit the application?
So I think, yeah, that's probably important. First, the person that would submit it is typically like the PI.
Yes,
right?
It would definitely be a faculty member, not from the student.
But do students sometimes support the research or help with it? How does that go?
Yeah, so like with tons of the research, they usually have like graduate assistants or some type of assistants, but it still would be submitted through their boss or through the PI, like you said, Ashley.
Okay. So probably generally there is, like a lead person, like, Dr.
Right.
Ukoli was the lead person, but I'm guessing that there are others that helped do the work behind the scenes.
They said not the application of research project. Like, could you explain a little bit more what you mean?
What is that question again?
So the person is asking about not the application process, but for the actual work. Like say they submit the grant, they actually are funded, and then in executing the work.
Well, if you
And
are
students and
writing a
others.
grant and you are the principal investigator, like as I was, you are conducting that research. You are doing the work. If there are two other people that you added as investigators who are working with you, you assign to them what you want them to do, but you are the one doing the main work. And you hire other people to work with you and for you, and you're responsible for everything. If anything goes wrong, you are responsible. The other people were working with you, and if they don't meet your standard, you have to change them. In my presentation, you saw I said I trained 4 navigators, but 2 were active because 2 were not doing what we wanted them to do. We had to let them go. And sometimes if you have a mentor and you pick a mentor, the mentor is not going to help you go and collect data. The mentor is just going to tell you how to get the data. They're not going to go with you to the field. So if you see the way I structured the salaries for the people on my team, I got 30 to 40% of my salary in this grant. But other people is like 10% or 5% because we didn't expect them to come and do the work. So that's what happens. The PI is responsible for doing the work.
Thank you, Dr. Ukoli.
Okay.
Good answer.
And I think we definitely, see and expect that there's sometimes some partnering, sometimes between the institution and someone else in the community.
Mhm.
So that's one of the questions here is kind of following up about that part. So for the project itself, not the application, but the project, should it include only our university community or health disparity on the local area? So I imagine it could be either, but it's
Right.
probably more common that it's the area, right?
You
It
mean,
doesn't have to be the local area per se, does it, Brian?
No.
well,
no. You can
it
partner with
has to,
whomever.
if you're all trying to give us money, you're giving Meharry some money to do something, why will I go and collect data in North Carolina? I will be collecting data around Nashville, around my locality, around my state, because other people will have a grant to do something where they are. But if I wrote a grant that said I was going to collect data in Africa and you funded it, which you shouldn't, because CMS covers the health of underinsured people in America. So any grant that we are writing must meet that little, criteria. That is something to do with the type of people that CMS cares for. And it is easiest to do something in the area where you are residing. But if I want to do something in North Carolina, then I get a co-investigator in North Carolina. So I'll be collecting some data here, and the other person will be collecting some data there, and we are comparing both. So it all depends on what somebody wants to do. You pick the correct team to be able to achieve what you decided you wanted to achieve.
Thank you. And so to kind of recap, most commonly it's going to be your local community,
Mhm.
not per se your university.
Yeah, the community.
That is
Yes.
It's not restricted to that, but it is restricted to something that CMS serves. So not Africa, but
Right.
the United States, the territories, tribal, it can be broad in that sense, though. Do feel free to put it in the chat again if we're not answering the question. It looks like I think we're good. So going on then to a couple other questions that we got in. Let's transfer real quick over to the chat so I don't forget these. Let's see. Dr. Ukoli, a question for you. Do you feel that your experience was beneficial through this program, was beneficial to the overall achievement of your study and your research?
Yes, it was. Of course, it was beneficial because at least 500 and something men got educated about prostate cancer, early detection and everything. A certain number of them got screened. So we achieved something. That was what we were trying to do. Not all of them were followed up and did what we asked them to do, but more than half of them did. So it was beneficial. And it was now an experience for me to develop another grant to do the same thing in Memphis, because I went on to submit another grant to do almost the same thing in Memphis, collaborating with a lady right there in the health center, in the Shelby Health Center. So it was beneficial.
And yeah, and I understand that, relative to some other grants, sometimes the funding amount can be considered small, but to start and initiate research and to grow it, it's often that research starts small and that this can be grown into other grant programs, other areas. And we've heard that from grantees in the past too. So thank you, Dr. Ukoli. All right, another question in the chat. Does the grant provide stipend tuition support for graduate students? So Brian, unless there's something I'm not aware of, I think it's more so about how you would disperse the funding depending on like who would be employed as a.
Okay, I can address that. I
Sure,
can't just take my grant and assign a full-time salary to a postdoctoral fellow or somebody. That's like $50,000, $60,000 for a year. Your money is gone. So normally you can get a part-time. You can get a student or a graduate student working on your grant part-time. But if you, as the PI, is already fully funded from other sources, and you're only looking for 5% or 10% of your salary, you might get such a person, but is the person experienced enough to carry out all the responsibilities that you were supposed to carry out? So maybe it would be better to make that person write the grant, let that person be the PI, and you can be the mentor on that grant. So like as I am right now, I wish I had a junior faculty here. That person will be writing this grant as the PI, and I will be on it for 5 or 10% as the mentor. So that's what I would say. Yes, in short, you can get a postgraduate to be the PI, and then they are now responsible for everything.
Okay, so depending on who you're thinking of and what kind of role they would play versus who would be the PI, there's potential, I guess, then for some of the funding to go to income, I guess, or stipend, maybe, however.
It's all up to you and how you write up your budget proposal. It's up to you, like who you get. You can get a postgrad, you can get an undergrad. It's all up to you.
Okay. And Brian, there was another question about the page numbers for the grant.
Grant is. Could you explain that a little bit more?
The question is the grant 6 or 12-page grant?
And I'm confused.
Is there a page limit?
What they mean, right? Because it's definitely way over 6 to 12 pages. I think just the project narrative is 20.
Okay, maybe if that person is able to put a little bit more in, and we'll come back to that. All right, so one person said that they were registering for the application, but there was a message about creating a workplace to add them or to add them to an existing workplace. This is a person that's coming from Howard University, so you all know that that would be an eligible institution.
Mm-hmm.
Any tips there, Brian, or maybe there's a general contact or they can follow up with us?
Yeah, you have to contact someone on grants.gov, unfortunately. Like our website and grants.gov are not connected. Totally different folks.
Okay. So there's,
Maybe someone else from Howard has applied before, perhaps. That's what I'm thinking.
maybe. So is there a grants.gov contact for that sort of, or should we maybe encourage them to check the site and then email us if they can't find something?
Yes, that's what I would say do.
Okay.
But I'm gonna reach out to our grants office to see if they have a contact in grants.gov. And so send me that question, and then I will follow up, please.
Okay, great. And I'm going to put an email address in the chat. This is, Brian checks it directly, but this is particularly for this grant program. So that will be a good email to use for this type of question if you can't get the answer through grants.gov, or some additional assistance is needed. So that would then be if you're having problems during the submission. Most of them are grants.gov related, but so there might be some limits to what we can do, but we certainly would want to know if you had something going on, if there might be something that we can assist with. But do check the site too for any help that they would be able to offer directly. Likewise, someone asked if there was a program officer person to write to before, during, after. So there is, and mostly it's Brian. And so Brian's the one who would be usually checking at OMH grants at cms.hhs.gov. That email address is in the chat. But there's, should you be awarded the grant, there's an entire team really that's kind of on standby to offer technical assistance. They have a learning series, newsletters and things to try and keep everybody up to date, know what's going on, share information. So should you be selected for the grant, there's really quite a bit of support. And one of them is, Brian is still the lead from application to close, but there's a team to support behind him. Do you want to speak to that anymore, Brian?
Nope, you're correct. We have a whole grants team here at CMS who, helps provide guidance as well after folks are awarded.
Looks like we had 2 more questions in the chat. We probably have time for a couple more if anybody's still thinking about submitting. So first one, I think this one would be to you, Brian, but welcome any additional thoughts. For those without grant experience, would it be better to collaborate with someone who has had experience to increase the likelihood of success? Or in other words, how much does one's experience influence the decision to make an award to a particular application?
So your experience does not affect, if you get the award or not. It really doesn't. So you could reach out to someone who has gotten the grant before, but it's not required. As long as your research proposal is good, then we're good, basically.
So it's more about the strength of the proposal than
Yes.
their CV.
Mm-hmm.
So in that terms, it might be good to have a mentor or somebody, offer guidance or comments before you submit. But it's not
required.
Not per se a requirement. All right. Another question, and I think this one's to Brian as well. Does this funding opportunity prefer applications that are focused on a specific health issue or health disparity related knowledge and or attitudes in general?
So that's totally up to you. Ashley, what would you say? Because I'm trying to say it without saying it, since we can't answer certain questions.
So I would recommend, in general, we can't say this topic would,
right,
be eligible, or this topic would work, or whatever. But it is probably best to think about what CMS is working on. Certainly, is it a program that CMS has, Medicare, Medicaid, Marketplace, CHIP? Is it a population our office is working on? Are we talking about the right people here? But then topic-wise, like if you wanted to get into like behavioral health or a particular disease or a particular condition, it's very open. I think we've seen a lot, sometimes broad and sometimes very particular. We have sometimes very specific disease focuses, and other times there's a broader focus. it might be good to look through like the CMS framework, the CMS OMH website, and kind of some of the equity pushes out of CMS to get a feel for what the agency in general is looking at. But it doesn't have to be one of those.
Right.
It's more about the strength of the proposal, I think, than the topic.
So this is what I'll say. If you search your topic on cms.gov and like you don't see anything about it, then I wouldn't submit a proposal about it. Like it should be connected to something, some kind of program or policy here at CMS.
There should be a connection, but it could be answering a question that we don't have. Maybe there's a data gap that a proposal could fill. So that's certainly something of value as well. So very, very much open. Unfortunately, we can't really directly answer the question, but hopefully that's helpful guidance. So we do have a couple minutes. If there's no more questions, we can always wrap up early. As you all think, let's go ahead and advance to the next slide. So this is contact information this is for Dr. Ukoli. Was kind enough to provide this for us. And if we advance one more, this is, of course, again, the same email you saw before, and then our website with all of the information about the grant program. So if you're looking for a link to grants.gov, details about the populations, examples of past grantees, that video that we saw, all of that can be found on this website, which is go.cms.gov/minority research. And then if you have questions, issues with your application, or any other pieces that you want to reach out to us about, please feel free at omhgrants@cms.hhs.gov. So we'll do a last call for any questions before we wrap up today.
So again, unfortunately, we can't answer that question because it's too research specific.
Yeah, so the question in the chat is, could we research mental health issues like stress or coping in relation to student success in a nursing program? So we can't answer specific questions about what you could or couldn't research, but we generally encourage folks to apply. All right, so we'll do a last call for any questions, but as always, we are here otherwise, and we really thank you for your time today. Glad you could join us, and we hope that you apply.
Thank you all.
Thank you.
Thank you, Dr. Ukoli.
Thank you.
Thank you, Dr. Ukoli. You were great.
Thank you.
All right. Thank you. Take care. Have a great day.
Okay. So we can.